and welcome to Medical Dialogues. I'm Dr. Bhumika. Let's look at today's top medical news. 1 in 3 cancer patients visit emergency department 90 days before diagnosis. About 1 in 3 patients diagnosed with cancer in Ontario visited an emergency department in the 90 days before diagnosis, found a new study published in Canadian Medical Association Journal. In a study that included more than 650,000 patients diagnosed with cancer between 2014 and 2021 in Ontario, 35% had visited an emergency department in the 90 days before diagnosis. Among patients with emergency department visits before their cancer diagnosis, 64% had visited once, 23% had visited twice, and 13% had 3 or more visits. More than half of patients with an emergency department visit before diagnosis were admitted to hospital. Preventing childhood obesity, digital technology may help parents. A study co-led by a Johns Hopkins Children's Center clinician researcher shows that adding text messaging and other electronic feedback to traditional in-clinic health counseling for parents about feeding habits, playtime and exercise prevents very young children from developing obesity and potentially lifelong obesity-related problems. The findings were published in JAMA. The current study focused on using digital technology to reinforce elements of the Green Light program, which previously only consisted of written materials and health counseling during primary care visits. The researchers recruited nearly 900 parent-infant. More than 55% were considered to have limited health literacy based on the newest Vital Sign, a widely used health literacy screening tool developed by researchers at the University of Arizona, and nearly 16% reported household food insecurity, meaning limited access to healthy food choices. The infant parent pairs were randomly sorted into 2 groups. Both groups received Green Light program education with counseling on healthy nutrition and behaviors from their primary care providers, along with 8 educational booklets matching the child's age at regular well visits with guidance and goal-setting tips in English or Spanish on feeding, physical activity, sleep and screen time. Next half of the infant parent pairs received personalized interactive text messages from a fully automated system to support health behavior goals and also access to a web-based dashboard designed to help parents keep track of healthy goals. Poor people have poor cognitive status. Socioeconomic factors such as education, occupation and wealth influence the likelihood of developing cognitive impairment or dementia in later life, and whether a person is likely to recover, finds a new study led by the UCL researchers. The research published in the Scientific Reports followed 8442 adults aged 50 and above in England over 10 years from 2009 to 2019 to examine how socioeconomic factors at the start of the study were associated with changes in the cognitive status. The researchers tracked how these people moved between various states: healthy, mild cognitive impairment and dementia. They also considered the possibility of reversals where individuals improved from a mild cognitive impairment state to a healthy one. Thank you for watching Medical Dialogues. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe and press the bell icon.